The Health and Longevity Center. Colon hydrotherapy as preparation for a colonoscopy. What factors will contribute to more colonoscopy patients? An aging population as baby boomers reach retirement age. Encouragement by government to have health insurers cover colonoscopies at no extra charge. Increased awareness of colon cancer, aka the Katie Couric effect. Colon cancer is the third largest cancer killer in the United States. Over 100,000 new cases are diagnosed every year. This procedure is highly recommended for people over 50. Yet, about 50% of people avoid having a colonoscopy. Some reasons people don't have colonoscopies: procrastination, fear of doctors, or hearing bad news, skepticism of its accuracy in finding polyps, laxatives and oral sodium phosphate bowel cleansers that cause abdominal pain and diarrhea. It has been shown that laxatives dehydrate the body, and they can be habit-forming. In fact, the FDA has warned against some bowel preparations. Some have been known to cause side effects with patients with renal problems.
FDA is notifying healthcare professionals about an association between oral sodium phosphates for bowel cleansing and a type of acute renal failure called acute phosphate nephropathy. These occurrences, which are rare but serious, have been associated with both OSP liquids, such as Fleet phosphosoda, and OSP tablets, such as Visicol.
Patients at increased risk of acute phosphate nephropathy include the elderly, those with kidney disease, dehydration, or decreased intravascular volume, and those using drugs that affect renal perfusion or function. And these include diuretics, ACE inhibitors, angiotensin receptor blockers, and possibly NSAIDs.
FDA is suggesting several precautions when choosing a bowel cleanser for patients. Here are a few of them.
First, avoid using OSPs in patients with kidney disease, impaired renal function or perfusion, dehydration, or uncorrected electrolyte abnormalities, including hyperphosphatemia.
Use OSPs with caution in patients taking diuretics, ACE inhibitors, angiotensin receptor blockers, or NSAIDs.
And instruct patients to take the correct OSP dose and drink sufficient quantities of fluids during their bowel cleansing.
Yet, there is an alternative. Colon hydrotherapy is an ideal preparation for a colonoscopy. Colon hydrotherapy is a gentle procedure that infuses warm, purified, filtered water into the large intestine or colon. It uses no chemicals or drugs. It cleanses the entire colon, relieves constipation, and gets rid of gas and bloating. The filtered warm water helps to soften, break up, remove impacted and dehydrated fecal matter, mucus, parasitic, and other waste material. Colon hydrotherapy usually takes about 30 to 45 minutes. About 3 to 7 pounds of impacted and excessive fecal matter, mucus, and bacteria is removed, leaving the patient feeling light and refreshed. Colon hydrotherapy massively hydrates the body due to the natural ability of the colon to absorb water. Colon hydrotherapy trains the colon to do peristalsis. In other words, it wakes it up. Colon hydrotherapy helps the body detoxify, which gives its own strength to heal itself and to fight disease. As this news report shows, some gastroenterologists recommend a colonic before colonoscopy.
You are looking at a colonoscopy in progress with gastroenterologist Dr. Marvin Prince, keeping a close eye on the screen for colon cancer.
Open your mouth, Kevin.
The patient undergoing this screening for the second time is Kevin Norris, who says getting ready that first time was no picnic.
With the fasting the day before, and then you'd have to take the phosphosoda, and there's a lot of toilet time.
But this time, preparing for a colonoscopy was a lot more convenient and soothing. This was Kevin just 45 minutes before getting his system cleansed while listening to music and lying comfortably. thanks to colon hydrotherapy.
The machine infuses warm, filtered water throughout the colon, and there is a therapist that massages the abdomen.
Says it's all about removing the roadblocks to having a colonoscopy.
Colon cancer starts in a small little polyp. So if we can go in and remove those polyps, you never get a colon cancer.
Now a 2-day process is basically down to 2 hours.
You fill up with this warm water, which is very soothing.
Dr. Fiorito says flushing water in and out is a viable alternative to liquid laxatives that can cause a lot of discomfort the night before, especially for the elderly.
Some of the preparations, such as fleece, have resulted in kidney damage, kidney failure in the elderly, electrolyte abnormalities. So there is some danger to some of these preparations for these patients.
And with the hospital study showing hydrotherapy as good or better,
Hydro is superb.
Doctors are encouraged more people will undergo a colonoscopy in the fight against colon cancer, the third leading cause of cancer deaths.
A study published in the Hebei Medical Journal in China showed that colon hydrotherapy was successful in 98% of cases. Closed system versus open system colon hydrotherapy. The open system colonic bed allows waste to drain into a basin. It's often unsanitary and leaves an odor. The patient is sometimes left unattended. The therapist doesn't even have to be in the room. And sometimes it can even be embarrassing for the patient. However, with the closed system, waste drains via a tube without spillage. A disposable sanitized speculum is used. The therapist stays with the patient during the whole procedure, and the patient's dignity is respected. Our procedure is simple. A small, sterile, disposable rectal speculum is gently inserted into the anus. The speculum has a separate water and waste line that is attached to the hydrotherapy equipment. The therapist then begins a series of gentle infusions of filtered water into the colon, controlling the water temperature and pressure. As soon as the client experiences any urgency or fullness, the waste line is opened. The water, along with old fecal matter, gas, and mucus, are released through the waste line and then through illuminated viewing tubes so that the amount and type of waste being eliminated can be thoroughly assessed. The waste line is then flushed away through the sewer line. Colon hydrotherapy uses state-of-the-art equipment. The pressure and temperature are controlled by a trained colon hydrotherapist at all times. The therapist keeps the temperature and pressure at comfortable levels based on the client's feelings. Hence, there is a decreased chance of intestinal discomfort. It's less messy. There's no need to fast beforehand. It's drug-free and not habit-forming. And this could encourage patients to get regular colonoscopy. The Health and Longevity Center is qualified to perform colon hydrotherapy. Who are we? We were established in January 2000. We are an integrative and holistic health center devoted to helping people live longer, healthier lives. We offer individualized, synergistic programs using high-impact, science-based therapies and treatments that deliver results. Why use the Health and Longevity Center? We use a closed-system colonic therapy that is less messier than the open system. We have a licensed medical doctor on site. We have 3 trained International Association of Colon Hydrotherapy certified specialists. And we're minutes away from most medical facilities. Our colon hydrotherapy equipment is cleared or certified by the following organizations. We can guarantee the procedure is completed within 2 hours before the colonoscopy.